Today, I'm going to share a few of my personal doctor stories, share why I no longer trust most doctors, and also share how you can get the medical care that you deserve. So stay tuned. If you're new here, hi there. I'm Amanda Malacheski, functional nutrition health coach and digestive and allergy detective. For the best tips and tricks about how to manage your digestive and allergy challenges naturally, be sure to subscribe and hit the bell to be notified when I post a new video every Monday. So would you agree if I told you that women are systematically underserved by our current healthcare system? I used to think it was just me. I've had a lot of negative experiences with healthcare practitioners, but I just recently read a book by Maya Dusenberry called Doing Harm that showed me that no, actually, this is a systemic problem. Today, I'm going to tell you about the book Doing Harm by Maya Dusenberry, and I'm going to share my top 5 strategies to ensure that you get the care that you deserve from your healthcare providers. So let's get started. So I've told a few of my healthcare stories before, especially in my earlier video called my endometriosis and IBS story. You can check that out if you want to hear more about that. But there are so many more that I could talk about, like the gynecologist who had a photograph of Mel Gibson pinned to the ceiling over the exam table, or the 11 years between my first symptoms of endometriosis and my final diagnosis during surgery. When I complained about tenderness in my intestines in an area that I could feel on the outside of my body, which really concerned me, my doctor at the time said, well, maybe you just shouldn't mess with it. Then there was the moment when I was really concerned that I had ovarian cancer because I had a lot of ovarian pain and repeated cysts. And my doctor sort of said, if it was cancer, you'd be dead by now. Even though those symptoms of pain and bloating are regularly occurring symptoms of ovarian cancer. But the most distressing period was the time when I was severely ill with regular panic attacks, nausea, frequent diarrhea, pain in many areas of my body, and ongoing fatigue. And when I went to the doctor and we ran a bunch of tests, like standard blood tests, they all came up normal. They said I was fine. So I wasn't normal or fine, but everybody just sort of shrugged and said, well, there's nothing we can really do about this except offer you birth control pills or antidepressants, which my doctor was smart enough to know that I wasn't interested in, and suggested that stress might be the cause of the problem and recommended maybe I go to therapy. But I was already in therapy, and my therapist actually suggested that maybe it might be time to start practicing acceptance and stop trying so hard to find something wrong. Even though I could tell, I knew for sure that something was really drastically wrong in my body. So a year later, I was diagnosed with stage 4 endometriosis during surgery. And my organs were so damaged at this point after years of letting this problem go without treatment that I had to have a partial hysterectomy. We had to remove my uterus. It was severely damaged. And my surgeon had to surgically separate many of my pelvic organs, which were stuck together with scar tissue. So much for all those symptoms being in my head, right? So when I read Doing Harm by Maya Dusenberry over my vacation last week, I was surprised but not surprised to hear so many stories from women who had a really similar experience. They didn't necessarily all have endometriosis, but they had things like heart disease and autoimmune conditions like lupus. They had mystery illnesses like chronic fatigue syndrome or Lyme disease that aren't really officially even recognized necessarily. And the author, Maya, really skillfully walks us through the historical context of how women have systematically, over the last several hundred or even 1,000 years, been discredited in their accounts of their health problems. She talks about the ways that we have been characterized as hypochondriacs, as dramatic, as hysterical women, and as unreliable reporters of whatever's going on in our bodies. So despite this reputation, however, many illnesses that were previously thought to be attributed to things like hysteria have actually now been documented. So for example, a disease like multiple sclerosis, which causes neurological symptoms, was previously attributed to psychogenic symptoms. But once we were able to use technology like the MRI, medicine was able to document the nerve lesions that cause the disease. So it's possible that many of these mystery conditions that medicine currently doesn't recognize are actually just diseases that have not yet been medically documented. Even more disturbing were her descriptions of how doctors, when being trained to be physicians, they're trained to think of these as psychosomatic symptoms. They're trained to deal with patients with complex symptom pictures like me and maybe like you as psychosomatic malingerers who are just trying to get attention or who are having psychological symptoms or who are seeking pain medication. Furthermore, these doctors typically in medical school get very little training on illnesses like autoimmune diseases and some of these other mystery conditions I mentioned, like Lyme or chronic fatigue syndrome. These conditions affect a much larger percentage of women than men. And the research money that's assigned to them to study them and to try and understand what's going on with them is a much smaller proportion than for diseases that are either more balanced by gender or that affect men more intensely than they do women. So I can't tell you what a relief it was to read this book, even though I intuitively knew this, to say, I'm not alone in this. I'm actually part of this bigger story. I'm part of this bigger picture, and maybe you are too. So I highly recommend this book called Doing Harm by Maya Dusenberry for a really thorough discussion of this issue and how it plays out in medicine. Given that the health system is stacked against us as women, what can you do going in to see the doctor to make sure that you get the kind of care that you deserve and that you are entitled to? I'm going to share a couple of tips that some of these are things that Maya suggested, and some of them are my own ideas about how to make sure you get the care that you deserve. The very first thing I want to offer you is to absolutely, above all else, trust yourself. If you feel inside yourself that something isn't right, it's probably not right. And I really want to encourage you not to be gaslighted into thinking that your symptoms are all in your head or that there's nothing wrong. We can really easily question ourselves when somebody questions our integrity or our own self-knowledge, but we know when something's not right in our body. So trust yourself above all else. The second tip I have to offer you is one that I feel really conflicted about and I'm uncomfortable about, but it's the sad truth. And Maya talks about this in her book. Is that as women, we are much more likely to be taken seriously when we take a man with us into the exam room. So have all your feelings about that, but if you're really having a struggle getting the help that you need, try and go to your appointment with your partner, your husband, your brother, your uncle, your dad, even, sadly, your son. It makes a difference. The third thing I want to offer you is that you can feel empowered to request testing that you feel would be beneficial or that might reveal important details about your case. And even if your physician isn't willing to help you with that testing or order those tests for you, you can order labs that you feel are important from direct-to-consumer lab companies like Life Extension or directlabs.com. There's many others as well. And you can just order those tests and do your research or find somebody to help you interpret them. So I encourage you to take advantage of that. The only disadvantage is that you pay out of pocket, but often it's not that much more than ordering the labs through your insurance. Next, I want to suggest that if you can afford it, and I know this is a huge issue in the integrative medicine space, but if you can afford it, seek out the services of a naturopath or a functional medicine physician. These practitioners are trained to think holistically about your whole picture, and they're much more likely to be willing to dig with you for the answers that you're looking for and play the detective role that your standard medical doctor may not be willing or may not have the training to do. So find those functional medicine or naturopathic practitioners to help you. Finally, don't expect a standard MD to be able to come to the level that you're hoping they will. I encourage you to really, try and use their services for what they're good at, which is diagnosing, maybe prescribing, and for getting referrals to specialists or other physicians. You really want to rely on more holistic practitioners to provide this role that I think many of us are hoping for, which is someone who's really going to look at our case and consider all the details, do some digging, really think about what's happening here and why, Most standard MDs aren't trained to do this kind of work, and if you expect that of them, we're just gonna be disappointed. So though I hope all of you have wonderful doctors, I know that the sad truth is that many of you don't. And I hope that these tips can help you get the care that you really deserve in your case. You deserve to have someone look at you and look at your medical history and figure out what's happening and what you can do about it to improve. So I'm curious, if you've had any annoying doctor stories, share them in the comments below so we can all support each other in that. And I want to also let you know that as an allied functional medicine practitioner, I am trained to help you figure out how to use diet and lifestyle to improve your health situation and improve the quality of your life with chronic health conditions. So I've mapped out how this process looks in my freebie. It's called the Roadmap to Gut Recovery, although it applies to any condition. And you can grab your free copy of Roadmap to Gut Recovery at confluencenutrition.com/roadmap. If you're in a place where you're ready for some pro-level support in managing the details of your daily life to improve your health situation, I encourage you to schedule a free 30-minute assessment session with me. I can help answer some questions, get you started, and see if what I offer might be a useful service for you. You can schedule that at confluencenutrition.com/contact. And if you like this video, please let me know by liking it below, subscribe, and share it with your fellow digestively challenged friends or family.